some summary statements here. So this is a good one. The causal relationship between mental illness and crime is relatively weak, the authors assert. However, these social determinant, structural oppression, psychosocial factors, poverty, undereducation, unemployment or underemployment, poor social supports, these are things that are more common among people who do have a history of mental illness, particularly serious mental illness or chronic mental illness. Together, they are more likely to become involved in the criminal justice system than just based on their mental illness on its own. Okay, so in other words, people who have mental illness and even what they call serious mental illness and don't have these other factors are much less likely to get involved in the criminal justice system. Okay, but people who do have chronic mental health or addiction conditions are much more likely to have these factors. And thusly, that's the connection the authors assert with mental illness and the criminal justice involvement risk. Okay? Inability to regulate severe stress. And what happens when we don't have healthy support, like good cognitive behavioral therapy, for instance, seeing a social worker like you once a week to help manage stress, right? As a for instance, what do people do? They engage in unhealthy behaviors, right? Substances of abuse, internet, social media, video games, pornography, gambling, things that are not good for their brains to regulate that stress. And all of the above puts them more risk for criminal behavior. Okay. Acting out of frustration through violence is a criminal justice risk in the way that we've talked about earlier. Self-medicating with drugs, alcohol, sex, or gambling, right? When people are in pain, whether it's emotional pain or physiological pain, their brain is wired to seek relief. And if they can't get the relief, if they don't avail themselves, if it is available or it's not available at all, meaning healthcare treatment, medical treatment for that pain, they will go find it on their own through unhealthy behaviors or behaviors that are kind of it's more insidious than just unhealthy. It's short-term immediate relief with longer-term downstream effects that put them in a place that's more painful and worse from a kind of functional consequence standpoint than they were before the self-medication, right? But when people are desperate for relief, the promise of very short-term relief, even if it's going to come with like a high interest rate, if you will, at the end, a social interest rate, people are still going to do it. Okay. Environmental stressors may trigger a relapse. So when we think about the community, one of the things I don't like about VoiceThread is you can't flip back and forth among the slides when you're in the middle of an audio or video clip. But anyway, if you just for a moment imagine the previous slide about the community factors, or the place factors or community factors, these environmental or community factors can trigger or exacerbate symptoms of mental illness or substance use disorder or addiction, and generally erode people's ability to regulate severe stress in a healthy way. So these are some more summary statements. I think most of these three we've already kind of touched on as the authors begin to wrap up the article. All right, so some recommendations from authors who have put all this time and work to put together this what I think is a very well written article. Whether you agree with all their assertions or not, the article itself is pretty well put together. So we need to address trauma, stress, treatment compliance, anger management, and skill building, social skill building, and kind of occupational skills, stress management, mindfulness training. These are all things, supports for pro-social living, um, uh, helping people develop and maintain healthy, positive relationships, uh, providing people opportunities and encouraging them to participate in pro-social activities, right? Employment, education, volunteering, healthy recreational activities, and of course, substance use treatment and recovery. These are all things that need to be part of our criminal justice reduction program, if you will. Not that there's one necessarily out there, but when you think about programs like First Step, the authors are saying these have to be pieces to that program if you want to truly achieve the goal of reducing criminal justice involvement on a measurable level.